10 crucial tips to never fail the Next Generation NCLEX again. If you failed the Next Generation NCLEX, you've come to the right place. You may have even failed it several times and are feeling frustrated at the moment. What you need to do is let the tears flow, have a mental health day, and get ready to pick yourself back up. In this video, I will share 10 key tips to overcome anxiety and pass the daunting Next Generation NCLEX exam with confidence. Tip number 1. Assess unless in distress. As a nurse, you cannot diagnose. Do not act without assessing and getting the information. Do not act without a healthcare provider's order. You have to take a look at the multiple choices in front of you and eliminate intervention choices and focus on the assessment choices unless the scenario warrants you to act upon the patient's distress. If the patient is not in distress, then you will focus on gathering information. Here's an example. A nurse is preparing to administer metoprolol 50 milligrams at 10 in the morning. The nurse took the blood pressure, which was 77/44. The nurse is alert and responsive. Which of the following actions should the nurse take next? A. Retake the patient's blood pressure. B. Administer the antihypertensive medication. C. Call the provider immediately. Or D. Hold the medication. In this scenario, there is no indication that the patient is in distress since it directly stated that the patient is alert and responsive. The first step is to know that metoprolol is an antihypertensive medication. The second step is knowing that an antihypertensive medication should not be given if the blood pressure is too low. A patient that has low blood pressure would normally not be alert and responsive, so the nurse should assess by retaking the patient's blood pressure medication. The nurse should not just take action and hold the medication without the provider's order. The provider should be called after retaking the patient's blood pressure. Tip number 2. Do not bring your medical or hospital experience into the question. If you are a CNA or LPN, you may look at the question and say that you're familiar with the scenario and would choose an answer based on your experience. Unfortunately, what we do in the real world may not be applicable to every question. Here's the scenario. As a previous hemodialysis nurse years ago, I provided catheter care, but my LPN worker was not allowed to provide catheter care. Whereas in Pennsylvania, LPNs can provide catheter care. Not sure if that's still true at this point, it's always changing, but at the time they weren't able to. I would not be able to look at the exam and make the assumption that LPNs cannot provide catheter care at all just because this was the case at my hospital. The NCLEX exam is not going to bring scenarios that may differ from state to state. Every scenario mentioned on the NCLEX will be universal across all states. Tip number 3. Do not pressure yourself to memorize everything from your comprehensive review. The NCLEX exam is actually not expecting you to memorize everything. There is no way to know every patient's condition and what is going on with every patient, especially as a brand new nurse-to-be. Even if you have a great memory, you will still encounter a patient with an unknown condition, and as a nurse, it is essential to be able to assess properly. The NCLEX will not provide you with questions that are expected of an experienced nurse of 10 years. The goal is to read the scenario in each question and be able to answer the question as a new nursing graduate. If you focus too hard on comprehensive review, you should now prioritize test-taking strategy and get yourself acquainted with improving your critical thinking skills. Tip number 4. When it comes to psych questions, prioritize safety. In general, the safety of the patient should be prioritized for any scenario. Test takers tend to look at psych questions and jump straight to the psych multiple choices and overlook the detail that concerns the safety of the patient. For example, a patient is prescribed Haldol to treat mental disorders such as schizophrenia. If the nurse was listening to the patient's concerns and noted that the patient started having a seizure, the nurse must prioritize the patient's safety before the patient's concern. Tip number 5. Get yourself comfortable with prioritization and delegation. There are plenty of books to help you get acquainted. I also have a video on this to help you review how to delegate work as a registered nurse, delegation review for the Next Generation NCLEX. Do not delegate what you can eat. We have heard this time and time in nursing school, and now it's time for a refresher. Do not delegate evaluation, assessment, and teaching. Remember that accountability is not transferred when a task or patient is delegated to another staff member. The 5 rights of delegations are the right task, right circumstance, right person, right supervision, and right direction and communication. Use the 5 rights to answer the NCLEX question in order to eliminate some of the multiple choices. Do not delegate tasks for patients that are unstable. Before we move forward, don't forget to grab your 160 free digital flashcards at qdnurses.com/start. These will help you master some of the trickiest NCLEX concepts and build your confidence before the next exam. Tip number 6. Create an NCLEX study plan. You will not be able to retake the NCLEX exam for at least 45 days. Create a plan, choose the exam date, and then make sure you stick to it. Test takers tend to delay the date and keep pushing it off, especially repeat test takers. If you plan to take it 60 days later, stick to it. Your plan should include daily studies with breaks. Don't push yourself to study 10 hours straight every day. Don't push yourself to the point where you end up going crazy. Spend a week on each topic. For example, week 1 is medical surgical. Week 2 is maternity. Week 3 is pediatrics. Week 4 is pharmacology. Week 5 is psychiatric, and week 6 is fundamentals of nursing. Week 7 is NCLEX test-taking strategy. You can pick whatever order you want. I just threw something randomly, so there's no importance to the order that I just mentioned. For each day, I practice alternate format questions and regular multiple choice questions to ensure that I understood what I was reviewing. I also made sure to take a day off instead of studying every single day of the week. Some people study in 6 weeks. Others chose to study over 8 weeks. There's no right or wrong answer, as test takers have families to attend to or full-time jobs to include in the schedule. Just make sure to create an NCLEX study plan that is realistic. Tip number 7. Know your ABCs: airway, breathing, and circulation. Patients that have airway problems or require airway management should be prioritized. Are there possible airway obstruction? The airway is clear if the patient is able to speak normally with normal breathing patterns. For breathing assessment, the nurse should know that the normal respiratory rate is between 12 to 20 breaths per minute. Bradypnea and tachypnea indicate the patient's condition is deteriorating and the patient must be prioritized. If the patient is in respiratory distress, action must be taken to stabilize the patient. Circulatory assessment includes assessing the patient's capillary refill time. The skin should also be inspected for adequate oxygenation. Are there blue discolorations of the skin? Is the skin warm to the touch or cold and sweaty? The level of consciousness is also used to determine the patient's status. Is the patient awake, able to respond in a conversation, respond to pain, or is the patient unresponsive? The nurse must know that a low blood pressure can indicate the deteriorating condition of the patient. Keep these tips in mind when addressing an NCLEX question and remember to prioritize the patient's airway, breathing, and circulation. Tip number 8. Know Maslow hierarchy of needs. For physiological needs, if the patient is having problems breathing, then this need must be prioritized over other needs. For safety and security needs, falls, medication, safety, and infection risk should be addressed. For love and belonging needs, support from family and friends should be highlighted. Family visiting the patient can make the patient feel cared for. For self-esteem needs, recognizing the patient's accomplishment and encouraging independence can help address these needs. For self-actualization needs, encourage the patient to engage in activities, and setting recovery goals can play a role in helping patients achieve personal growth. The patient's needs are prioritized from the bottom to the top. Love and belonging should not be addressed before physiological needs. When looking at the multiple choices, see which part of the pyramid the multiple choice falls under and make a selection based on which need should be prioritized first. Tip number 9. Get comfortable with select all that applies question. It becomes overwhelming to look at each choice and have to decide which and how many are the correct answer. Treat each option as true or false statement in order to eliminate the incorrect choice. This is exactly why I created videos to review NCLEX true or false statements. Don't forget to check them out. The more true or false statements you practice, the more confident you will get. And finally, tip number 10, address your weaknesses. Focus on the areas that require the most improvement. Take practice NCLEX exams to identify your strengths and weaknesses. Here are the NCLEX client needs strategies. 1. Safe and effective care environment. 2. Management of care. 3. Safety and infection control. 4. Health promotion and maintenance. 5. Psychosocial integrity. 6. Physiological integrity. 7. Basic care and comfort. 8. Pharmacological and parenteral therapies. 9. Reduction of risk potential. And 10. Physiological adaptation. Give yourself a pat on the back and reward yourself for the sections that you excelled in. Then create a game plan to address the categories that you need to improve in. I myself had to take the exam several times and I passed in my 3rd try. I know many colleagues who had to take the exam several times. So let's get it out of the way that failing it does not make you incompetent or less smart than those around you. Passing it on the 1st try or the 5th try will not change the salary that is offered to you. Take what you learned from this video and apply it to your NCLEX studies. You are not alone in how you feel. Breathe, take care of yourself, and do not give up. Looking for more tips and tricks to make your journey even more fun and engaging? Check out my next video where we dive into more essential nursing school hacks. Remember to hit that red subscribe button to keep supporting our channel. Keep up the great work and I'll see you in the next video. Happy studying!